as you hear the path, things change. And normal people change jobs. Like I meet with my brother-in-law and he lives in the Bay Area. Those guys change jobs all the time. Physicians are like serial monogamous. We don't leave. We just have our paths. And the things, so that's my long buildup to the answer to the question, what would I do during fellowship? I would explore as much as you can. I would talk to faculty in academia. If there's private practice people, I would talk to them about their experience. I would talk to VA people. I would talk to Kaiser people. I would talk to as many people as you can talk to because they all have strengths. They all have pros and cons. And the thing is, don't be afraid to change. So what you like now, you're big deal. If you live in just change, do it, change jobs. And I say that a little cavalierly, but most of us are afraid to change gears. And at some point, you're going to have to think about growth opportunities. And I would say, and you please chime in what you think, around 6 years into practice, you're probably at your relative peak. I mean, it takes 6 years to kind of get your feet under you and do what you're doing. But from 6 years on, you have to find other things that will keep you interested and motivated. I think it's rare to have these days people who go into practice, clinical practice every day, all day, forever. So you need growth opportunities. So explore all of them there.
Dr. Wong, what about you?
Yeah, I mean, I echo a lot of things that Paul just discussed. Again, you know, my track has been basically in academia. And so it's like, well, why are you in a clinical practice panel? But I think, you know, what my perspective is really kind of having seen fellows think about a lot of their options in fellowship, trying to best advise them. And so I just echo a lot of what Paul says. You know, I personally, you know, have not left academics. However, what many of your mentors in academics won't tell you is how much they've actually thought about it and how much they've explored that. And so I just echo what Paul says, you know, while you're a fellow, talk to as many people as you can. I routinely recommend to fellows when I meet with them, if it seems like there's an interest in going into clinical practice, to really, at least in our local area, so we're in San Francisco and in the Bay Area, reach out to people, just chat with them. Folks are so willing to have you just shadow, just spend some time with them in their practice, because it looks so different from from how things look in fellowship. And even having an academic position or a clinical practice academic position looks really different from what it looks like in fellowship. So, you know, it's the same things no matter what you want in your career. But, you know, if you're going to the ADA, or if you're going to the Endocrine Society, or at a smaller scale, you know, in pediatrics, if it's PES, you know, just use those opportunities to get to know people. And I know it's hard. It's hard to like cold call people or just go up and introduce yourself, but lean on your mentors, and hopefully in your fellowship program, lean on your mentors, lean on, if they're your research mentors, your career mentors, to just say, hey, could you introduce me to so-and-so? Because that's where it starts to happen. And that's where you start to get a window on what people do. And so I just agree with that. And don't be afraid when you're at that time, you know, late in your second year, maybe your third year, trying to think about what the possibilities are. Just try. I mean, go and interview places, even if you think there's no way I'd ever take this type of job, or no way I'd go to this location. You can't know what they have to offer if you don't go and just find out. And that's absolutely what you should do. The other piece of advice which I give our fellows is, like, if you have that inclination early on, you know, as you're doing your research, as you're practicing inpatient medicine, all of those things, you know, make it can be, I know there's this disconnect sometimes in some fellowship programs. It's like, no, we're training academic physicians only. And I know that's like that at our institution too, but your mentors should recognize and know that if your intent is to really explore clinical medicine, because then your whole practice, or not your fellowship training, will look a little bit different. Maybe you'll actually end up doing a little bit more clinic, or if your program allows this, or you'll do a little bit more inpatient if you think you want to do a little bit more kind of more of an academic practice type clinical medicine, and make it known so that you can tailor ship your fellowship opportunities. And then the last thing I'll say on this topic is the things that might seem irrelevant. So for example, research projects, QI, all of that, those are the things that are going to be relevant in your practices. Like Paul just said, after you've kind of got over the initial hump of, oh my gosh, I'm on my own and I don't, I have to make all the decisions by myself, which is both great and also terrifying. Then you're going to want to do something more, and you're going to pull on those experiences from fellowship, whether that's, let me look and join this clinical study, or let me really think about quality in our setting, or let me think about how can I get involved in advocacy. So all of the things, think of these little opportunities in fellowship as things that you'll pull back on, even if it looks like you're going into a job that is just purely clinical, because you will want to use those. And they also, to be honest, make you a little bit more marketable. If you go in and you say, I have this strong interest in quality improvement, or I really have done a lot in terms of advocacy for diabetes at the state level, or whatever it is. And so,
well, on that note, you mentioned interviewing a variety of places, a variety of institutions, a variety of different practice models. What do you recommend going into a job interview? What do you recommend focusing on, asking about? What are the top things that, looking back retrospectively, you guys would recommend really knowing before you make a decision about how to proceed?
I mean, here's a couple red flags. There's an institution here that shall be unnamed that does not get a fellow ever from the University of Washington. No fellow will go there. So if you look at a system and they have no fellows from the regional training program, that's a red flag. Why will no local fellow go there? And it happens. It definitely happens. So that's an easy one. The second one is make sure you like the people you work with. I mean, that seems basic, but if your gut says, I don't know, then I would listen to that. Like, you don't want to work with someone forever who you don't know. If you're not sure, then that's bad. Trust your gut. Those are two easy ones.
Great.
I think, something similar to what you've heard, I think, throughout already your career in terms of interviewing. I agree. People are really important. Not just your peers, but your supervisor. So getting a sense of the type of people they are, how, some of the questions that I've asked or have recommended asking are how people respond to change and what changes are ongoing in a particular clinic or a particular division, and what the response is to that. Opportunities for growth, a clinical position, depending on your interest, to the point that I was making earlier, if you have a little bit of interest, even if it's 100% clinical position, are there examples of others in the practice who have made time to do a little bit of research or teaching, or if it's a pure clinical situation, or just doing something different, and what are those different things? Because if there are examples of people doing those types of things in that location, that means that there's a precedent for it. It would be a little harder if someone promised you, oh yeah, sure, you can have 10-20% time to do this, but then you look at the practice and no one else is doing that. Probably might mean that they're telling you that they'll give you something, but it may not happen. Those are the types of questions that I would ask, and really just getting a sense of who your colleagues would be, how happy they are, a sense of if people have been there and left, kind of to what Paul said, or is this a job that's having a hard time hiring people? Is it, or a hard time retaining people, and for what reasons? And then things that you might look for yourself that are going to be different for different people are a mix of clinic, outpatient versus inpatient responsibilities, for example. I know there was a question here about admin burdens and prior auths and things like that. So how much support is there to the point of the panel that was right before us, delegating everything? You want to be in a practice where or you want to it's different for different people, but you want to understand what your support is for that practice. So if in diabetes, for example, there's an educator, what does the educator do? What do? What does the case manager do? Because really in practice, you should not be doing prior auths. So you want to know like who is doing that type of work in that practice, and kind of understand what that flow is and make sure that their support is there, because you're going to want to understand what that is in whatever environment that you're in.
And I might add one more thing too, because it's pertinent and timely. I would ask them what happened during COVID. I would ask how their practice managed COVID, because your answer will inform a lot of things down the road. I was very happy to work for a big company and or a big system during COVID because my job was protected. But my old practice group, they had to lay people off and their revenue stream dropped. And all of a sudden, you're not getting a paycheck. So, I mean, it's not that pay matters exclusively, but it's a reality that you have to understand. And that question will inform you a lot on what happens when things go sour, right? You want the surgeon who knows how to deal with things when things go sour. Like a routine cholecystectomy, fine, everybody can do that. You want the surgeon who knows what to do when things go sour. Same thing with your practice system. When things go sour, how'd they deal with it?
Yeah, great. I was going to get to a couple of more questions from the attendees if we can. Let's see. Any advice for fellows looking for part-time clinical practice and working in digital health alongside?
So I think, well, two things. To part-time, I think there are, at least in our area, there are more and more locations that are hiring part-time just in general. So not to the digital health part. And I think what you have to be careful of with part-time is does it truly mean part-time, or are they just paying you part-time and you're actually working a full week? So just kind of keep that in mind when they say, oh, you're 60%, but you know, again, getting a sense from your colleagues on your quote days off or on that admin time, you know, what does that really mean? And you'd want to be pretty clear that when you're off for whatever reason, if you're looking for part-time. So I think that more and more practices are doing that, which is great, you know, for any reason why you might want that, but just, you have to be really careful, because I think sometimes it means you're paid part-time, but you're putting in a full week's of work. Digital health alongside part-time is also kind of a fluid thing. And you heard from Dr. Neinstein, who's my good friend and colleague, in the last session, that opportunities in digital health are changing. You can just go out and get a full-time job in digital health, but I think, as he mentioned, there are often digital health and startup companies that just want consulting part-time. I wouldn't rely on that though as kind of a ongoing source of income, to be a consultant for a digital health company or any actually pharmaceutical company for that matter. There are those opportunities, but I don't know if I would rely on that as a continuous source of income. But happy to kind of chat about that kind of digital health offline too, because that's a little bit of a more complicated field.
Yeah. Let's see. Any advice on fellows on a visa doing waivers? And what do you how to recommend proceeding once done with the waiver?
I don't have much experience with that. One of my co-fellows was on a waiver and ended up working in St. George, Utah, for a few years. So he ended up working in a rural community for a while. Now he's got his own practice in a suburb of Austin. That's one thing. I mean, I think you find a small place to work for a while, and then hopefully that helps.
Yeah. Let's see. What's the best way to ask if there will be mentorship for fresh grads going into clinical practice without sounding needy or incompetent? I think we have a minute left.
Yeah, that's a good question. I don't think asking for mentorship when you're starting out, I don't think at all sounds needy or incompetent. And if the practice you're looking at feels it's needy or incompetent, then maybe you shouldn't be at that practice. I think it's totally understood. You're going to need to ramp up. Practices should allow, they should. I just had this conversation with our graduating fellows, allow you time to ramp up in whatever that looks. So if it's an RVU model that they're not looking at that as strictly to bring in revenue, you know, the patients that you're supposed to see should slowly ramp up. And then mentorship, I think, if it's not already built in, because some clinics, Kaiser is one of them, have a built-in mentor. And if you need that, just ask for it. And again, like I said, and ask for it in the interview process, so you know, and the negotiation process, ask for it then, because if they don't give it to you then that I would say, I don't know if this is, you know, a good place to be if they're not willing to give me that mentorship.
And you can ask what your schedule will be like in the beginning part of when you start. So if they say, oh yeah, you'll be full-time, 8 a.m. to 5 p.m., that will not work. I mean, you should effectively be part-time with a full-time pay for some period of time, 2 months, 3 months, 1 month, something. I would say at least 3 months before you go wide open schedule.
Yeah,
you can always add more later.
Yeah, I agree with that. I think ramping up is really important. You know, if I would be a little bit cautious if someone didn't ask for a mentorship or some sort of guidance at the beginning, because I think it's really important regardless of what level you are, you know, transitioning to a new place. Okay, so I think we are almost out of time. 39. Any last comments, questions from anybody?
It looks like we have 2 minutes, or a little slightly less than 2 minutes. I'm trying to look at the chat as well. Phil, I also wanted to say, I don't know if it's shared, if our contact information is shared with all of you, but I'm happy to chat with anyone offline. I kind of typed it in, but I'll put my email in the chat, but it's just jenise.wong@ucsf.edu. It's not complicated, but happy to continue conversations with anyone later.
Same.
Great. Thank you guys so much for a great discussion.